Hi everyone, my name is Eric Wisotsky. I'm the Program Director of the MedStar Health Georgetown National Rehab Hospital PM&R Residency Program. I want to welcome you to our program. I hope this video gives you a great opportunity to meet the amazing faculty, residents, and fellows in our program here, and also get exposure to the amazing, vast array of learning opportunities we have here in our program. As a program director, I have two main goals. One, of course, is to train amazing, well-rounded, skilled, knowledgeable, compassionate physiatrists of the future. Here at the MedStar National Rehab Hospital, a freestanding hospital, we have all the opportunities under the sun to see everything, the entire gamut of rehabilitation. And as part of this program, you get to see really all the bread and butter rehabilitation in abundance. All the traumatic brain injuries, spinal cord injuries, and other diagnoses come here to this hospital, but also amazing learning opportunities at our affiliate sites, such as Walter Reed Military Medical Center, where you get your amazing electrodiagnosis training, the next door Veterans Hospital, Children's National Medical Center, the National Institutes of Health, where you get to do a clinical rotation and potentially high-level research. There's just so much to offer here to turn you into great physiatrists. My second goal is to train what I like to call the happy physiatrist or the happy physician. And this is really my biggest passion, is to tap into the passions of our residents. So what is it that makes you tick? While we're going to teach you all of PM&R, I really want to know what interests you most and how can we tailor your education to meet those interests, to set you up for those goals in your career, whether it's fellowship or job goals. And not only that, other interests that even aren't necessarily clinical that we fostered through the years here, whether it be social media interests, whether it be community service. We've had interest recently in things like esports, taking care of gamers with musculoskeletal injuries. So whatever those interests are, we really want to take those, foster them, and we really hope that this is going to translate into making you the physician you want to be, make you excited to work, excited to be a physiatrist, and have a long, happy, fulfilling career. So we can't wait to meet you, and we hope you enjoy learning more about our program.
Hi, I'm Emma Nally. I am a brain injury attending at National Rehabilitation Hospital. We have a locked inpatient brain injury unit that has 30 beds. You expect to see a wide variety of diagnoses as well. We also see a lot of stroke patients, hemorrhagic stroke patients, and then kind of the classic brain injury patients as well. Our patient population really reflects the diversity of Washington, D.C. As a resident, I had a wonderful experience here. I really enjoyed the continuity clinic here too, which has kind of fostered my love of brain injury.
I'm Stephen Zhao, now a PGY2, finally made it across the bridge. I've been able to encounter many of these different complications after TBIs, and Dr. Natalie has really shown me how to navigate, how to manage and treat some of these conditions. It helps me learn. She's extremely humble in the way she teaches, which makes the learning much easier.
I'm Dr. Erica Gosai. I am the spinal cord injury attending on the NRH floors. With me, you'll learn a lot about both traumatic and non-traumatic spinal cord injury. And also I do a lot of wound care, so when the opportunity presents itself, you'll learn a lot about wound care at different levels of intensity.
My name's Marla Petrillo. I'm one of the PGY3s here. It's kind of exciting to say that. So I'm currently on our spinal cord injury rotation with Dr. Gosai. Personally, is one of my favorite rotations. We get to do a rotation in our PGY2 year, and then we get to do it again in our PGY3 year. Doing that so close together, I think, has been a really good experience. It's such a great specialty that we can really help our patients, and we get to see so much progress while they're here. It's a little overwhelming as a PGY2, but when you come back with Dr. Gosai as a PGY3, you have a little bit more insight into what's going on, and you feel a little bit more comfortable, and you're just able to really kind of take off.
Matt Kelly, currently the Sports Medicine Fellow here at NRH Georgetown. I was previously here for residency and was our chief resident here last year as well. Part of the big draw bringing me here to NRH and then staying on to do the sports fellowship was some of the unique sports opportunities that we have here. Adaptive sports was kind of my first draw in. We have a pretty robust rec therapy program here at the hospital, which blends nicely into some community outreach.
Hi, I'm Dr. Rachna Malhotra, and I'm the Medical Director of the Stroke Recovery Program here at NRH. Our stroke rehab program here is very large. We see about over 600 strokes a year, which is one of the largest stroke programs in the country, which is great, and we're very proud of that. All the PGY2s work with me for a month, and then they come back and work with me as a PGY3. So as a PGY2, I expect you to do the basic stuff, handle the floors, basic floor work as you would do as an intern. But the big thing about rehabilitation and stroke rehabilitation is just more than just managing blood pressure, managing diabetes, which you are pro at by the time you finish your internship in PGY2 year. By your third year, when you're with me, I really expect you to kind of run the service. More interaction with the team, with our case management, our physical therapists, occupational therapists.
I'm Hani Batal, PGY3, currently on the stroke service with Dr. Malhotra.
Dr. Batal actually was an intern with me for a month.
Right.
And then you spent 2 months with me for PGY2, and now I think 1 or 2 months, and now as a PGY3, being more of a team leader as a senior resident, but also just for the stroke service itself is just keeping people from having more strokes.
I work primarily in neurorehabilitation, so everything stroke, brain injury, spinal cord injury, multiple sclerosis, and anything else neuro. So you're going to get that experience on the outpatient side. We get a chance to really work with patients on a very long-term basis and really try to work with them to build up their functional skills and maintain them over their lifetimes.
I'm Dr. Howard Gilmer. I run the amputee program here at National Rehabilitation Hospital for approximately the last 10 years. I get to see the residents twice, once during their PGY2 year and then during their senior year. At first, I just want you to be able to identify the prosthetics. And then their senior year, I expect you to identify, but then tell me why we would use a certain prosthetic versus another and what would be best for that patient. Oh, I was a graduate, residency program, 2001. So I've been here a long time.